ጤና ይስጥልኝ የተከበራችሁ የዚህ ቪዲዮ ተከታታዮች። ይህ ቪዲዮ የተዘጋጀው በኮይካ ኮሪያ ተማሪዎች ማህበርና በኢትዮጵያ ኮይካ ቢሮ ሲሆን ዓላማውም አገራችን ኮቪድን ለመከላከል እያደረገችውን ጥረት ተጨማሪ አቅም እንዲሆናት ተደርጎ የተዘጋጀ ነው። ውድ ባለድርሻ አካላት በኮቪድን በመከላከል ውስጥ የጤና ባለሙያዎች ድርሻ ትልቅ እንደሆነ ይታወቃል። የኮሪያ ኮይካ ተማሪዎች ማህበርና የኢትዮጵያ ኮይካ ቢሮ ምንጊዜም ከመንግስት ጎን እንደሆነ በማሰብ ይህንን ቪዲዮ እንድታዩት እጋብዛለሁ።
I'm Eun Young-go, Senior Advisor of International Tuberculosis Research Center in Korea. I'm very honored to share with you the unique features of Korea's epidemiological investigation and response. Thanks to Koika Edupeer office for giving me this opportunity. I would like to share the information on epidemiological characteristics of COVID-19 in Korea, public health responses to COVID-19 outbreaks, and epidemiological investigation and contact management. South Korea has experienced the MERS outbreak in 2015, lasted for 2 months. Overall case fatality rate was 20%. Key lessons learned from MERS outbreak are: a single missed case may trigger a huge nationwide outbreak. The first line of defense is the doctors in the community clinics and hospitals. The importance of early case detection and isolation of cases, and the importance of providing accurate and timely information with the public. This is the epidemic curve of COVID-19. As of 21st September this year, 23,045 cases were confirmed with COVID-19. Among them, around 3,000 of cases are imported cases. 385 cases died of COVID-19, and the case fatality rate is 1.67%. Around 2 million tests have been done, and overall test positive rate is 1%. There were 3 major outbreaks, 2 religious groups related outbreaks, and 1 clubs related outbreak. This graph shows the newly confirmed cases, released cases from isolation, and isolated cases by date. Currently, around 20,000 cases were discharged from isolation, and 2,412 cases are under isolation. This map shows the regional distribution of confirmed cases, and some metropolitan cities and provinces show over 50 per 100,000 incidence rate. This graph shows age and sex distribution of COVID-19 cases. Among the total confirmed cases, female cases are composed of 54%, male cases are composed of around 46%. The age group of 20s has highest incidence rate with 68.7 per 100,000, and 60s and 70s show incidence rate of over 50 per 100,000. As of 21st September, 385 cases died of COVID-19. The case fatality rate of male is 1.9%, and female case fatality rate is 1.46%. For now, the case fatality rate is 1.67%. Case fatality rate is highest in above 80s with 21%, and the case fatality rate of 70s is 6.6%. The case fatality rate of 60s shows 1.16%. Among the 141 severe and critical condition cases, 68 cases are in severe condition. Severe cases are treated with oxygen mask and high-flow oxygen therapy. 73 cases are in critical condition who are treated with mechanical ventilator, ECMO, and continuous renal replacement therapy. 90% of severe or critical cases are over 60s. This graph shows the proportion of imported cases decreased over time and cases from local transmission increased. So far, among the total cases, 392 cases are imported from abroad. It is composed of 13%. In most metropolitan cities and provinces, there were imported cases. Majority of imported cases are from Asia, excluding China, America, and Europe. There are 5 components of public health response to COVID-19 epidemic. The 5 components are early diagnosis, response to cases, prevention of import cases, and ensuring treatment of non-COVID patients. To early diagnose the cases, following measures are implemented: expansion of diagnostic testing, expansion of local screening centers, specimen collection via drive-through mobile facilities and door-to-door visits, and performing diagnostic tests for pneumonia patients. To respond to the cases, thorough epidemiological investigations and contact management have been implemented. COVID-19 confirmed cases. Patients are classified by severity and allocated the bed by severity. For the mild cases, residential and treatment centers are provided for the isolation and monitoring of symptoms were performed. To prevent of imports of COVID-19, self-quarantine of incoming travelers for 14 days and tests for COVID-19 are implemented. And to ensure the treatment of non-COVID patients, Korea has run the national safety hospitals and has allowed for receiving prescriptions by phone and by proxy. Since raising the national infectious disease crisis level to serious on February 23, 2020, the Korean government has assembled a central disaster and safety countermeasures headquarters headed by Prime Minister to increase the government-wide responses against COVID-19. Social distancing measures recommended based on the epidemic situation. Quarantine measures were introduced from the early stage of epidemic. From April, self-quarantine and tests were recommended for all travelers from the abroad. Korea has strengthened the public health infrastructures and response level, strengthened the surveillance system to gather timely information on epidemiological data, and assess the risk to make decisions on response measures as well as national crisis level. KCDC shared the epidemiologic data, including newly confirmed cases, deaths, and clusters outbreaks in transparent manner through daily media briefing. To intensify the contact investigation and management, KCDC has fully engaged with local government to prevent COVID-19 outbreaks in healthcare facilities. Newly confirmed cases in healthcare settings have been reported immediately, and thorough contact tracing and management have been implemented. Korea has operated tiered laboratory network from the national to the local level that is evenly distributed throughout the country. There are 95 private clinical laboratories and hospitals who can perform diagnostic tests. On average, 15,000 tests can be performed per day. Korea uses COVID-19 nucleic acid testing, real-time RT-PCR to diagnose a case, established specimen transport arrangement system. Specimens can be transferred to the KCDC within 24 hours for confirmatory testing where necessary. To ensure early case detection of patients, Korea has operated a drive-through sample collection system and walk-through testing facilities, which allows quick and safe collection of samples from a large number of people. Target people of test of COVID-19 are persons who are suspected cases or patients under investigation. Definition of suspect case is who has fever or respiratory symptoms like cough or shortness of breath within 14 days of contact with a confirmed COVID-19 patient during the confirmed patient's symptom exhibiting period. The definition of patient under investigations are a person suspected of COVID-19 according to a physician's opinion for reasons such as pneumonia of unknown causes, a person with fever or respiratory symptoms within 14 days of entering Korea after visiting another country, a person with fever or respiratory symptoms with an epidemiological link to a domestic COVID-19 cluster. KCDC has intensified contact investigation and management of contacts with the following measures: investigation, risk assessment, and contact classification and contact management. First, interviewing patients and determination of the location of the contacts. If necessary, complementary methods including checking medical facility records, phone-based GPS, card transaction records, and CCTV were used. Second, exposure risk evaluation. Third, classification of contacts. Fourth, management of contacts. Based on the risk analysis of exposure, contacts were classified with close contact and casual contact. For close contact, movement restriction and symptom monitoring has applied. Movement restriction is a legal public health order, and quarantine or controlled travel is enacted. Symptom monitoring was performed as either active or passive monitoring. For casual contacts, the symptom monitoring has applied. As explained before, this is how KCDC and local government perform epidemiological investigation and management. There are measures to deal with privacy issues regarding collection and use of personal data for epidemiological investigation. Privacy-sensitive data are not collected for every confirmed cases. The need to collect such data is carefully assessed. Information collected during epidemiological investigation is managed as safely as possible with strict security measures in place and is destroyed when the investigation is over are required by law. Since MERS outbreak in 2015, there has been effort to recruit and train epidemiological intelligence EI officers at both central and local levels. Currently, there are 75 EI officers at central level and 54 at metropolitan city or province level. We also have a pool of around 300 private epidemiologists that have been appointed to work on COVID-19 response. Local public health centers, which are around 256 nationwide, also have capacity to conduct basic contact tracing and preliminary epidemiological investigation. Korea also has 11 local level support centers for control and prevention of infectious disease. Although these centers are not government organizations, their management, operation, and allocation of budget is based on private-public partnership. During the emergency period, these centers take part in as a response team. These support centers conduct preliminary investigation within their cities or provinces, working in partnership with local public health authorities. As the number of patients rapidly surged in Daegu City and Gyeongbuk Province starting late February, which caused shortage in healthcare resources, Korea has created a new system for allocating hospital beds based on the severity of the patients. This system enabled more medical resources to go to the more severe patients in need of urgent care, allowing more efficient treatment and management of patients. As mentioned above, patients confirmed with COVID-19 are classified into 4 categories based on the severity: mild, moderate, severe, or extremely severe. Mild patients with mild symptoms are placed in home quarantine, self-quarantine, or admitted to a living treatment center and may later be transferred to a hospital if their symptoms aggravate. Moderate patients are admitted to hospitals with capacity to treat infectious disease patients. Severe or extremely severe patients are admitted to tertiary hospitals which have great capacity for treatment. This system allows patients to receive the care they need in a timely manner. These pictures show some of living residential treatment centers. Persons who are considered high-risk groups are classified as severe patients regardless of clinical symptoms, so that they can receive timely care if needed. High-risk groups include elderly, and persons with underlying chronic conditions, and other groups described here. Quarantine measures has been applied, requiring a 14-day self-quarantine or isolation in facilities for all travelers entering Korea. At point of entry, all inbound travelers go through heightened quarantine procedures, including a fever test and a questionnaire on their health status. During the 14 days of quarantine, travelers continue to use the self-diagnose application to update their health status. Those failing to do so will be contacted and tracked by local public health centers. Furthermore, the Korean government tests all travelers. Those with symptoms are tested in quarantine facilities at Incheon International Airport. Foreign nationals without symptoms are tested in temporary living facilities, and Korean nationals without symptoms are placed under self-quarantine and are tested within 3 days upon arrival at local public health centers. From the early stage of epidemic, Korean government advised to the public about the code of conduct as above. So far, Korea has flattened the epidemic curve without shutting down the country, nor the city with the epicenter of the outbreak, without imposing an extreme personal travel or movement restriction, and without closing airports or taking other authoritarian actions. One of the important response actions are public-private cooperation and civic awareness and collaboration. From the early stage of the epidemic, Korean government advised to the public about the code of conduct as follows. Postpone or cancel unnecessary outings, gatherings, eating out, events, and travel. If you have fever or respiratory symptoms, do not go to work and get enough rest at home. Avoid physical contact, such as shaking hands with others. Keep a 2-meter distance, complying with personal hygiene practices such as hand washing and coughing etiquette, and wear a mask in public places. For the working places, to minimize the dense working environment, measures such as expanding the employee sitting interval, telecommuting, flexible work are implemented. Postpone or cancel business trips and activate phone calls or video conferences are encouraged. In summary, the successful factors of Korea's responses are early case detection and contact management through thorough epidemic investigation and extensive laboratory tests, sharing of epidemiological information with the public in transparent and timely manner, and people's compliance on public health measures, including wear of masks in public places. You can find more information on Korea's response in detail in the Tackling COVID-19 report. You can find detailed epidemiological investigation and case management method in above journal, and you can find the daily update and KCDC's website. I would like to specially thanks to Dr. Park Oh for sharing of thoughts and information. Thank you very much for your attention.
ቪዲዮን በማየት ትልቅ ግንዛቤ እንደጨበጣችሁ ተስፋ አደርጋለሁ። ኮሪያ 2015 ላይ መርስ ሚድል ኢስት ሪስፓራቶሪ ሲንድረም በተባለ በሽታ ስትጠቃ ከዛ ያገኙትን ልምድ ተግባራዊ በማድረግ ኮቪድ ላይ መንግስታቸው የሚያወጣውን መመሪያ በመከተል ያላንዳች አስገዳጅ ሎክዳውን ኤፒዴሚክ ከርቡን ፍላት ማድረግ ችለዋል። እኛም የኢትዮጵያ ጤና ሚኒስቴር እና የኢትዮጵያ ህብረተሰብ ጤና ኢንስቲትዩት የሚያወጣቸው መመሪያዎች ተግባራዊ በማድረግ የዕለት ዕለት ተግባሮቻችንን ሳናስተጓጉል ኮቪድን መከላከል እንድንችል እያሳሰብኩኝ በኢትዮጵያ ኮይካ ቢሮ ስምና በኮይካ ኮሪያ ተማሪዎች ማህበር ስም ማመስገን ፈልጋለሁ። ማንኛውም ጥያቄ ሀሳብ ካላችሁ በዚህ ቪዲዮ ስር በተዘጋጀ ቦታ እንድትጽፉልን ማሳሰብ ፈልጋለሁ። ስለቆይታችሁ አመሰግናለሁ።
Now we would like to share the results from last year's customer satisfaction survey. Public Service Customer Satisfaction Index, which we call the PCSI, is conducted annually by Korean government in order to measure the quality of public services provided by all Korean public institutions, including KOICA. For KOICA, it is special because we have international customers in country offices, and all country offices are responsible for submitting a long list of international customers who experience KOICA service from October 2018 to June 2019. Typical customers are officers at Government of Ethiopia and line ministries and our volunteer institutions and implementation partners like UN agency and international NGOs and other all individuals in Ethiopia. The survey request was sent to customers via email, and the survey link included questions regarding service quality, social responsibility, comparative assessment, and overall satisfaction of customers. PCSI survey for 2019 was conducted from December 2019 to February 2020. According to the result that was circulated internally, KOICA as an institution as a whole, we received quite high satisfactory level on average. But the breakdown result showed us that we can do more in Ethiopia. First of all, the participation rates for the survey was a little bit lower than the average. This may be because our customers from Ethiopian long list were excluded at the end of the process of random selection, or the customers who got actually invited to the survey simply did not participate. Another improvement that we can do is to improve our service quality to partners who are working for line ministries, because the index among them showed a little bit lower compared to the country average. Now that we shared the survey results from last year, we would like to make a kind request for upcoming survey for this year. The survey for 2020 PCSI will be conducted from December this year. Some of you will be randomly selected and will get an email from Korean government asking survey participation. Once you get the strange email asking your experience and opinion about KOICA, please do not ignore and be involved. To improve our general quality of services, we, KOICA Ethiopia office, appreciate any suggestions and concerns from all our customers regarding the service we provide in Ethiopia. Thank you.